All right, good morning. So this is going to be the hands-on infant formula lecture. We're going to go through the formulas that you will use primarily in the first 12 months of life, but including those in premature infants. And so we'll get started. First and foremost, there's two really helpful pediatric and review articles. The first is Updates in Infant Nutrition. It gives you really good foundational knowledge about all of these formulas and helping to explain some of the concepts that I'll touch on today. And then the other is sort of a step-up guide to tube feeding in infants, and it's a really good primer for general pediatricians and family practice doctors who may see these kids that are referred to GI but follow them up for preventative medicine reasons. So let's jump into it. I have split all of these up into basic classes that should be more easily remembered for you, and we'll talk about them one by one. This first group is going to be your premature infant formulations. I think we're mostly comfortable with Similac NeoSure. Whenever we get our preemies ready for discharge from the neonatal ICU, this is oftentimes what we use. It's got higher quantities of magnesium, phosphate, and calcium that premature infants are going to need due to lack of time in utero. Now, sometimes we'll actually transition them over to a more standard formula. You have preparations like Similac's OptiGrow, which is a 24 kcal per ounce at its base formulation, and you have Enfamil, which is a similar product called EnfaCare, and it is 22 kilocalories per fluid ounce. And the reason being, as you might assume, is that our preterm infants are going to need higher amounts of calorie. In this version, it's typically fat-based, but they also get those higher milliequivalents of magnesium, calcium, and phosphorus. You can calorically densify these formulas even more, but usually they're standardized just to make it easier on the parent. Now, if we eliminate sort of the idea of the preterm infant and we just go back to our term, something like Enfamil, this is actually even harder to find now. We get it in the hospital, but you really won't see it on the shelf. It's just their basic infant formula. Almost all of these formulas are now enriched with iron, so they're fortified with iron, but they're actually washed over by the Food and Drug Administration based on the 1980 Food Formula Act. And so there is quite an extensive amount of regulation that goes on with formulas, but it has not stopped the influx of all these different products. Especially from Enfamil, they've tried to increase some of their synthetic formulas to better mimic express breast milk, and that's come in the form of Enfamil NeuroPro and Enfamil Inspire. So the NeuroPro holds something interesting. It's human milk oligosaccharide, and that's a byproduct from breast milk that has been tied in rat models to increasing IQ. And so actually the folks at Enfamil wanted to call this Hi-Q, but the FDA thought that that was very misleading, and so they settled with NeuroPro. And Enfamil Inspire is something similar. It also has HMO in it, but it also has an added protein, lactoferrin, that is also found in breast milk and is thought to support growth. The reality is these two products are going to be much more expensive than its older brother, and you do want to be aware of that cost factor when you talk to your patients, because very rarely are these going to have a clinical indication that would be supported by any sort of insurance. Now we get into what I consider the grayest area of infant formulas, and it's partially hydrolyzed. And when we talk about formulas at this point, it really is about biochemistry, and we start to think about kilodaltons. How much do the molecules weigh? How big are they when they're passing through the infant's gastrointestinal tract? And so you have lots of them that are partially hydrolyzed. So when we talk about whey proteins, when we talk about casein proteins, some of these have partial hydrolyzation, but not fully. We'll talk about the ones that are fully. But it's where it becomes very difficult. You have Similac Pro Advance, you have Similac Pro Sensitive, you even have Similac Pro Total Comfort. Lots of pros. Which one should the professional use? I don't know. Similac Pro, just by itself, Pro tells you that that is Similac's human milk oligosaccharide modifier. And so any of their products that have Pro have an HMO in it. Now, if you compare Pro Advanced to Pro Sensitive, the difference is that their Pro Sensitive is less than 2% lactose. Now, if you look at Pro Total Comfort versus Pro Sensitive, the main difference is that this one is 100% whey hydroxylate, but there is still casein in here versus this is not hydrolyzed. So in the grand scheme of things, this has smaller particles than this, but they're still not fully hydrolyzed. And you compare it to Enfamil NeuroPro Gentle Ease, also a partially hydrolyzed product that is 20% lactose by formulation. So a lot of the time, parents will find these on the shelves. They think that their child has significant reflux, and usually it's not significant. They don't have alarm findings, they're not losing weight, but they do have reflux episodes. A lot of the old literature says about 75% of term infants will have reflux. It's probably even more, maybe like closer to 99%. At least in GI clinic, that's what we seem to see. These sorts of formulas have never been evidence-based proven to be clinically beneficial in decreasing reflux. In the first 2 weeks of life, maybe they have a benefit to decrease early onset infantile eczema, but it's not something that lasts, and so it's probably not worth the huge price tag. Now, one formulation that might be helpful are the rice starch classes, particularly Similac Spita, and as you might imagine, it thickens when it's exposed to liquid and especially acidic contents of the stomach, the idea being that those contents remain in the stomach and then are accommodated into the small intestine. Also not necessarily evidence-based as to work, a little bit more expensive than these cheaper options like regular Enfamil, but still something that you can think about. Now, probably the bane of most pediatricians' existence, and certainly the World Health Organization and the AAP, is use of soy formulas improperly. And really the only indications for these are going to be some hereditary inability to tolerate sugar products, carbohydrates, in the forms of hereditary fructosemia or galactosemia. Really beyond that, these are not going to show benefit, but you will see lots of parents buying them in the form of either Similac Soy Isomil or Enfamil Pro-Sodium. So we basically talked about how from here to here, we use these for a lot of different reasons, or rather parents do, and a lot of the time they use it for reflux or for weight gain and things like that, and they may not really work. So what does work? Well, the biggest two groups that actually do work are these right here. On the right is the extensively hydrolyzed formulas, and on the left are our amino acid. So the smallest molecules we can see, and really what should be the mainstream of general pediatrics when you have significant reflux, poor weight gain, red flag findings, starting something like a hydrolyzed. And these comes in the form of Nutramigen, Alimentum, and Progestamil. Now, what's interesting about Progestamil that you'll also see used a lot of the time is that it contains 55% medium chain triglycerides as its fat component. And that means that it's got a high content of fat that does not require a strictly functional biliary system to be absorbed. It can be freely absorbed across that brush border membrane and help significantly in children that have ongoing cholestasis, or you're trying to help them grow for whatever reason and they have reflux. This is a really good option. Probably more commonly used though is Alimentum, Similac's version of the hydrolyzed infant formula. It's about 35% medium chain triglycerides, so it'll still be very helpful in that respect. And then something that the gastroenterologist is much more adept at using, because we see the baddest of the bad as far as reflux, we have Neocate, Puramino, and Elecare. And these are strictly amino acid based. They've been fully digested to where it's only an amino acid that is hitting the gastrointestinal tract. And so they're very expensive, but will be supported by insurance. Neocate is slightly ahead of the curve in the sense that they have this Neocate Senio, which is combined with a probiotic and has been demonstrated in some of their small sponsored studies to have some benefit for reflux, and maybe that's better propagation of normal gut flora. But in any case, the last thing I want to leave you with is these work, they're evidence-based, they're supported by the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition for the management of infant reflux. They smell and taste terrible. And so the next step is we're going to actually try some of these formulas here, and hopefully that gustatory learning will stick with you in your practice, and so you can provide good return precautions and guidance to families as they leave your clinic. And that's it.